What is the placebo effect? The placebo effect happens when a patient believes they are receiving a real treatment, but they are actually given a placebo, a substance with no active therapeutic ingredients, such as a sugar pill or saline injection. Despite the lack of active ingredients, patients often report improvements in their symptoms. This effect is not just about positive thinking. It involves complex neurobiological reactions, including the release of endorphins and dopamine, which can alleviate symptoms like pain and stress. The placebo effect is a remarkable demonstration of the mind's influence over the body. It occurs when a patient experiences real improvements in their health after receiving a treatment that has no therapeutic effect. This phenomenon has been observed and studied for centuries, and it continues to intrigue scientists and medical professionals today. The history of the placebo effect. Early origins. The term placebo comes from the Latin phrase placebo domino in region vivorum, which means I shall please the Lord in the land of the living. This phrase was part of the Vespers for the dead in the Roman Catholic Church and was later used to describe treatments that were intended to please rather than cure. 18th and 19th centuries. In the late 18th century, the term placebo began to be used in a medical context to describe treatments that were given more to please the patient than to have any therapeutic effect. By the 19th century, the concept of the placebo effect, where patients experienced real improvements in their symptoms after receiving a placebo, started to gain recognition. 20th century developments. The placebo effect became a significant topic of study in the 20th century. In 1955, Henry K. Beecher published a landmark paper titled The Powerful Placebo, which argued that placebos could have clinically significant effects. This paper spurred further research into the mechanisms and implications of the placebo effect. The case of Mr. Wright, 1957. The case of Mr. Wright is one of the most compelling examples of the placebo effect in medical history. Mr. Wright was suffering from advanced cancer of the lymph nodes, with tumors the size of oranges throughout his body. He was bedridden and struggling to breathe, having exhausted all available treatments. Initial treatment with crebiazine. Mr. Wright learned about an experimental drug called crebiazine and believed it could cure him. Despite his critical condition, he convinced his doctors to administer the drug. Remarkably, within days of receiving the injection, his tumors shrank dramatically, and he was able to leave his bed and walk around. His health improved so much that he was discharged from the hospital. However, Mr. Wright's condition worsened when he read reports that crebiazine was ineffective. His belief in the drug's power was shattered, and his tumors returned. In a desperate attempt to help him, his doctors decided to administer a placebo, telling him it was a more potent version of crebiazine. Believing in this new treatment, Mr. Wright's tumors shrank once again, and he experienced significant health improvements. How does it work? The exact mechanisms behind the placebo effect are still not fully understood, but several factors contribute to its power. 1. Expectation and belief. When patients believe that a treatment will work, their brain can produce real physiological changes. This belief can trigger the release of neurotransmitters that help reduce symptoms. 2. Conditioning. Past experiences with effective treatments can condition patients to respond positively to new treatments, even if they are placebos. 3. The ritual of treatment. The act of receiving care, visiting a clinic, interacting with healthcare professionals, and following treatment protocols can enhance the placebo effect by making patients feel cared for and supported. Mr. Wright's case highlights the profound impact of belief and expectation on health outcomes. His dramatic responses to both the initial treatment and the placebo underscore the powerful role of the mind in the healing process.